So the mechanisms for hip injuries within the dance realm, it can accommodate many different factors. Barring any hip pathologies, and when I say hip pathologies, I'm meaning bone-on-bone contact or a morphology of the actual hip bone or the acetabulum itself. We're looking specifically at the muscular issues. So the things that we're looking at are, it's bulleted here in 3 different points. The mechanisms for this involve a lack of hip range of motion. Now, there's many different movements for the hip. There's hip flexion, where your leg is coming up, extension, internal and external rotation. So the things with that involve the lack of it, obviously. So this can be attributed to the short or stiff glutes. If your glutes are short or stiff, then that means they're just going to not be able to move and absorb force in a productive manner. They're always turned on, essentially. The next thing we're looking at is it's a cause of the anterior pelvic tilt, which just points to the mechanics of your actual pelvis. Essentially, your hips are tilted forward and your butt looks like it's sticking out. That's essentially what it's talking about. The next thing that we're looking at are weak adductors, which are the inside of our legs, and a weak abdominal musculature. There's several different muscles involved with the abdominals, but essentially if through the whole fascial chain, if we're not strong in this fascial chain, then we're not going to have the ability to absorb that force appropriately. So if we have 2 different things here, essentially, if we can't absorb force because our glutes are always turned on, and we can't absorb force further because our adductors are weak, there's an imbalance in that in that complex. The third thing is increase in activity or an increase in training age. So essentially, as you age, you're more likely to find yourself having these types of injuries just through an accumulation of time. If, of course, you perform, either literally perform or battle or compete over a period of several days continuously back to back, then it's also likely that you're going to feel some type of tweaking either in the hips or the groin area. So the things that we can modify, because we can't modify, at least from my point of view, the hip, actual bones of the hip, the things that we can modify involve the musculature. So if we wanted to affect the hip in a positive manner, we can increase the hip range of motion through several mechanisms. We can increase the hip range of motion, the hip internal rotation. The hip internal rotation can be affected just by affecting the tonic musculature or the tight musculature of the hips and like the legs. So if we can reduce tightness in our hamstrings, not by stretching, but through added pressure or massage or whatever mechanism you want to use, then we can begin to affect that balance and that strength balance in the hips. The next thing we're looking at are, if we wanted to perform glute stretches on a short or stiff muscle, that will also positively affect our hip range of motion. We can provide a link in the next or the bottom description for those stretches. The next thing we're looking at are relieving the hamstring tonicity. I think we went over this already. So the idea here is to increase the internal rotation of the hips, restore hamstring tonicity or relieve it, and then perform a glute stretch for those short and stiff glutes. The second point that I'm going to make here is, after you do those, which essentially goes to restoring parasympathetic functioning, the idea here is we're going to increase the adductor strength. So we're going to increase the adductor strength by doing different exercises. Essentially, you can do different what we call crushing exercises. Crushing to invoke the idea that you need to really work hard during this exercise. Essentially, you're going to have either a foam roller, a towel, or a ball, a small ball right around here, and you're going to perform different exercises that can also be described in the link below. And the third aspect is we want to increase the capacity for recovery. We just don't want to increase recovery overall. That essentially just comes down to saying, oh, I'm going to rest for X amount of days. While that is good-natured in its intentions, the idea here is we want to restore some parasympathetic function as opposed to always being turned on from a neurological point of view or always being sympathetically driven. So if we can recover better, if we have multiple bouts or multiple competitions back to back, if we can recover faster and we can recover more efficiently, then let's pursue that method, whatever that method may entail. So foam rolling, massaging, performing contrast baths, doing all those types of methods may invoke more recovery. Obviously getting better sleep as well will also help. And also attacking nutrition in a positive manner will also, in a roundabout way, help with our recovery. However, these are the main mechanisms that I'm looking at towards restoring a hip strain or tweak.